Last week, a patient came in convinced she'd torn the meniscus in her knee. Sharp pain, swelling, stiffness, trouble bending. Classic tear, right? Well, it turned out to be a flare of knee arthritis. If you're suffering from pain in your knee and you want to figure out, is this arthritis or a torn meniscus, then this video is for you. Today, I'm going to help you figure out which one you might be dealing with using simple self-tests you can do at home. Now, it's easy to get these mixed up. Both arthritis and meniscus pain show up with stiffness, swelling, pain with bending your knee, trouble squatting and going up and down stairs. But there are some important differences, and that matters because the treatment is slightly different. Using a combination of history, symptoms, and a few simple tests, I'm going to help you figure out if you have arthritis knee pain or pain from a torn meniscus in your knee. To understand what makes these different and why we treat them differently, think of arthritis like worn rubber tread on a tire. When that tire is brand new, it has a fair amount of rubber. Over time, that rubber wears out, and eventually towards the end of that life of the tire rubber becomes so thin that maybe some of the radial metal comes through. The tire becomes weaker. You get the idea. Arthritis is similar. We only have so much cartilage, and as that cartilage wears, our body isn't making new cartilage, and so certain spots of the joint, that cartilage can actually become pitted, the wear can become deeper, and eventually it can wear all the way through down to the bone. Cartilage is designed to carry weight, and it is nourished by movement. Bone, however, is not. And when that happens and your joint is what we call bone on bone, that can be quite painful and it can lead to swelling and all other problems. These are the key pieces of history information to figure out knee arthritis. This is a slow onset. That rubber on the tire did not wear overnight. This takes time. Stiffness is a predominant feature, and stiffness is typically worse in the morning because you haven't been active all night, and joints love motion. So you wake up, knee feels stiff. My patients tell me the pain from arthritis is like a deep ache. This is not a sharp or catching kind of a pain. When my patients come in and they've had a flare of knee pain arthritis, there's typically a combination of too much loading of that knee over too long a period of time. Classic example is travel. They go travel somewhere, they're on their feet, they're walking more than they're used to, they're doing stairs, which they never do, and all of a sudden they come back and their knee is swollen and painful. In contrast, the meniscus is like a rubber gasket in your knee. It stabilizes those two bones, and it's made of cartilage, which means it's not as strong as bone. Certain movements like bending and twisting under load or really fast can cause that cartilage to become injured. It can cause it to tear. When that gasket is injured, those two surfaces do not mate exactly the way they're supposed to, and therefore any motion might contribute to a feeling of tension on that structure, which becomes pain. So now let's start with your story. Let's talk about what makes your knee pain worse. Your knee's history will give us the biggest clues. Ask yourself these questions. Did this pain come on gradually, or did it come on all of a sudden? If it came on gradually, we're leaning more towards arthritis. Were you doing a movement and you felt a specific twist, pop, or catch with or without pain? If that's your knee, then you may be looking at a meniscus injury. Do mornings feel stiff and then loosen up after you've been up and moving for anywhere from a few minutes to a half hour or longer? That leans towards arthritis because cartilage loves motion. Does your knee catch, get stuck, or give way all of a sudden? Well, that leans more towards a meniscus injury because that gasket provides stability, and when it's injured, the knee may become unstable, or you might catch a piece of that meniscus when you move a certain way. Does sitting too long make your knee feel achier and stiffer? Classic arthritis symptom. That's because cartilage loves motion. Meniscus, like that rubber gasket, if you're not putting load through it, it's usually pretty quiet. Now it's time to test. I'm going to run you through a few simple screening movements that you can do. Although these are not 100% definitive, they are going to very clearly steer you in one direction or another and give you key information that you can then bring to your PT or your medical provider. Test number one is classic for a meniscus. It's the joint line press. Sit with your knee bent and press along the inner and outer joint line or the corners of your knee. Sharp pinpoint tenderness that's suspicious for a meniscus injury. If it's more of a diffuse ache, then that fits an arthritis pattern more clearly. The next test is a twist and load. Now this is a provocative test, meaning if it's positive, you're feeling more of that irritation. So maybe don't do this if your knee is exquisitely painful or it's super fresh. Stand on your sore leg with your knee slightly bent. Gently twist your hips a little bit left, a little bit right. If you feel any sharp pain or sharp pinching, that points towards a meniscus injury. If you feel dull soreness and ache, and it doesn't change whether you twist one way or the other, that leans more towards an arthritis diagnosis. Our third test is a squat. This is just getting up and down from a chair. Start sitting, slowly stand, and then slowly sit again. What did you notice in your knee? If you felt tightness, pressure, achiness, stiffness, or generalized soreness, that makes me think arthritis. If, however, you felt some sharp catching or there was a certain range that was bothering you, but other parts of the range of motion were fine, that suggests maybe more of a meniscus issue. Test number 4 is a simple stair test. If you have access to stairs, go up and down 4 or 5 stairs. Often if it's painful going up, arthritis may be the cause because you're putting more load through that. If you have parts of that range where maybe it's sharper, that may be more of a meniscus issue. How is getting in and out of a car? If getting in and out of a car, that twisting motion tends to be real tender for you, that makes me think more meniscus than arthritis. Arthritis is painful, but it's fairly consistent. It doesn't necessarily increase more when you're twisting off of that knee. For the next section, we're going to look at how your knee behaves when you do different things. If this is more of an arthritis problem, this is going to feel better when you move up to a certain point. 5 or 10 minutes of walking it out can make that knee feel significantly better. Sitting, being inactive can make that knee feel more stiff and sore. Strengthening will also help an arthritic knee, and that's why arthritis strength exercises are so important. If this is a meniscus, one of the hallmarks is going to be those sharp pains when you turn, when you pivot, when you bend through certain parts of your range of motion. After the acute phase and the swelling has come down, this meniscus is going to be fairly quiet when you are inactive. It's not going to become more stiff and achy. It's only going to light up when you put a load very specifically through that structure. And this is going to feel worse when you make turning, pivoting, or cutting movements. If you've made it this far, I hope you are well on your way to figuring out if your knee has more of an arthritis problem or a meniscus problem. Before we continue, and there's lots more to share, drop a comment and let me know if you think your knee is more of an arthritis or a meniscus issue. And if this video has helped you so far, hit that like button. It really does help other viewers find my work. If you felt like you have symptoms that straddle both sides of the fence, some arthritis, some meniscus, you are not alone, and it is not uncommon. Many times a knee with arthritis can also have a meniscus injury if you turn or move or do something unexpected. Be careful, especially if you've gone to a physician and you've had an MRI. Sometimes meniscus tears show up on images and they are not really the drivers. Pay closer attention to how your knee feels, how it responds, especially to exercise. If your knee gets better when you move it and exercise, even if there's a meniscus tear, exercise and movement and loading is going to be a good strategy for you. Let's talk about treatment. If your signs point more towards arthritis, then motion is the lotion, exercise is the key. Start with knee arthritis exercises. Pay particular attention to strengthening your quads, hamstrings, calves, and hips. Walk at least 10 minutes a day. Use a knee arthritis recovery program. This is a complete program that is going to combine modalities, things to make your pain better, bring swelling down, with progressive exercises and some mobility work. I help patients with this problem every week in my clinic, and I'm developing resources that I will share with you by visiting my website, agelikeanathlete.com. If you want more information on a total knee recovery program, please visit my website. I've got free resources there for you. If your signs point more towards a meniscus injury, this is important. Avoid deep bends and twisting of your knee for 4 to 6 weeks. The meniscus does have a small blood supply in part of it, and that structure can heal or stabilize to a point, and we want to let that happen without interrupting it. Deep knee bends or bending and twisting, anything that irritates that meniscus may slow that progress down. When doing exercises for the knee, emphasize exercises that don't cause you to load that meniscus, load that gasket-like structure. So that's going to be things like tightening your quad muscle and hamstring, working a lot on your hip, doing some light cycling. If your knee is locking or catching, go get it checked out right now. Take yourself to the good PT in your area or a good doctor who is an orthopedic specialist. Surgery is not often required for a meniscus, especially if this is the first injury, but you want to be sure you're doing the best thing you can for your knee health. So if in doubt, go get it looked at. Here's what we want to avoid when we have both arthritis and meniscus injuries. We don't want to stop all activity. You have to keep moving, and this is important. Even though it's painful, light motion like riding a stationary bicycle or doing some light rehab exercises is generally safe. It's not going to make either of those problems worse, and in fact, it'll help you heal. Another thing to avoid, don't jump straight into surgery. If this is a new injury, give this injury some time, at least 3 or 4 weeks, preferably 6 to 8, before you make a decision, unless, like I said earlier, you have that painful catch. Don't rely purely on imaging findings like an MRI or an X-ray, or Dr. Google or Dr. Chat GPT. Every knee is different. Find out from a specialist what your knee is going to require to be the best. Comment and let me know which tests were positive and how you plan to proceed taking care of your knee. I release new rehab videos just about every week, so be sure and hit like and subscribe to the channel. That patient I mentioned earlier, once we determined that this was pain coming from knee arthritis, we developed a series of knee arthritis exercises. After just a week, her knee is already feeling a ton better. I hope you've got something helpful from today's video. And as always, thanks for joining me.